If you're a new parent, you know it's an incredible time. But man, can it feel like you're drowning in advice? Today, we're going to cut through all that noise. We've got the essential, no-nonsense tips for newborn care, and they come straight from pediatrician Dr. Annie Ziemer, so let's dive right in.
Oh yeah, this feeling. I'm guessing it's pretty familiar. The sheer number of products, all the conflicting opinions on, well, everything. Sleep, feeding, cleaning, it's just a lot, especially when you're already running on empty.
So our goal here is to just simplify. We want to give you a clear, simple, and medically sound guide. We're going to focus on what actually matters in these first few months so you can spend a little less time worrying and a lot more time bonding with your new baby. We've broken it all down into 5 key areas. First, we'll get into what we're calling the comfort mindset. Then we'll cover the real rules of cleaning and how to prep bottles safely. After that, we'll look at keeping your baby healthy and maybe most importantly, how you can protect your own peace of mind through it all.
All right, first up, let's get our heads in the right space. To make a newborn comfortable, you really have to start thinking like a newborn, and that means understanding the world they literally just left.
You know, Dr. Ziemer talks about this critical period as the 4th trimester. It makes so much sense when you think about it. Your baby spent 9 months in this super specific environment. It was warm, it was snug, there was constant motion and sound. So the goal now is just to recreate that secure feeling on the outside.
So how do you actually do that? Well, it's all about mimicking the womb. Think warm blankets, maybe a white noise machine, or even just some soft background sounds. Gentle rocking and swaying, and making those quiet shushing noises. These are the basics for soothing a baby, because to them, this is what feels familiar and safe.
Okay, now let's talk about keeping your baby clean. And here's the headline: less is very often more. It's so easy to overdo it, so we're going to cover the real rules of bathing and a surprising tip that might just save you a ton of worry.
This has got to be one of the most common questions new parents have. I mean, you see all the baby bathtubs and products and you just assume it's supposed to be a daily thing. But what does the pediatrician say?
Just once or twice a week. Seriously, that's it. It might sound kind of crazy, but there's a really good reason for it.
As Dr. Ziemer puts it, newborns just don't get dirty the way we do. But even more importantly, soaking them in a tub of water actually strips away the natural oils from their super sensitive skin, which can really dry it out.
So, the takeaway here is to keep bath time short and sweet. Like 5 to 10 minutes is more than enough. You don't need to scrub them down. Just gently clean the spots that can collect gunk. You know, like under their neck, in their armpits, and around the diaper area.
When it comes to products, Dr. Ziemer's advice is to stick to the basics. A simple, low-scent soap is all you need. And for lotion, she says to avoid anything that smells like baby perfume. You know, those really fragrant products, and go for a thick, unscented moisturizer right after the bath to lock in all that moisture.
And here it is. This might be the single biggest stress reducer for new parents. Forget about those fancy bottle sterilizers. Dr. Ziemer is really clear on this. You do not need to sterilize bottles, pacifiers, or anything like that. Just wash them really well with regular soap and warm water, exactly like you do your own dishes. It really is that simple. Okay, so speaking of bottles, let's talk about feeding. It doesn't matter if you're using breast milk or formula, knowing how to store and prepare it safely is, completely non-negotiable.
These are the key numbers to just burn into your brain for breast milk. You've got about 4 hours at room temperature and 4 days in the fridge. And once you thaw frozen milk, you've got to use it within a day. For formula, it's even simpler. Once it's prepared, it's good for 24 hours in the fridge.
Now, this is probably the most important safety rule we're going to talk about. Please, please, never use a microwave to warm a bottle. It heats so unevenly, and it creates these little pockets of scalding hot milk that can seriously burn your baby's mouth, even if the bottle itself feels okay to the touch.
The right way to do it is also the easiest. Just put the sealed bottle in a bowl of warm water. Not hot, just warm. This lets the milk warm up nice and slow and evenly, right up to room temperature. And that's all it needs. It doesn't have to be body temperature, just not fridge cold.
All right, we've covered safe feeding, so now let's talk about keeping your baby healthy overall. This is especially true during cold and flu season, because a newborn's immune system is just getting started, which means prevention is everything.
Dr. Ziemer's advice here is really proactive and practical. Try to limit passing the baby around big crowds. Make hand washing with actual soap and water a non-negotiable rule for anyone who wants to hold the baby. Keep anyone who is even a little bit sick at a distance. And make sure you and other close caregivers have your key vaccines, like for the flu and whooping cough. Oh, and it's a great idea to ask your doctor about the RSV vaccine, either for you or the baby, just for that extra layer of protection.
And this can be the hard part, right? Especially with family you're close to. But think of this as your official permission slip. Setting these boundaries isn't being rude, it's being responsible. It is your job, as the parent, to be your baby's #1 protector. Asking someone to wash their hands before holding your newborn is a totally reasonable request.
Finally, let's talk about the most important person we haven't really mentioned yet. You. That anxiety that comes with being a new parent is so real, and it is so easy to feel like you're just not doing enough.
I want you to just let this message from Dr. Zimmer sink in for a second. The very fact that you are worried about being a good parent, that you're here watching this to learn more, that's the proof right there that you are a good parent. You care so much, and that's what truly matters.
And hey, if that caring tips over into anxiety that feels like it's just too much, that's okay too, but you do not have to go through it by yourself. Reaching out and talking about it is a sign of strength, not weakness. Talk to your doctor, talk to your pediatrician. They are there to support the whole family, and that includes you.
So, I'll just leave you with this question. After everything we've talked about, from skipping the sterilizer to bathing way less, what's just one worry that you can decide to let go of, starting today?